it off quick?
Sure.
Perfect. Well, welcome everybody. Welcome to our third learning session as part of Recreation Professionals Week this year in 2024. I'm very excited to be joined by Dr. Jackie Oncescu. I hope I pronounced it right. Jackie's associate professor with the Faculty of Kinesiology at the University of New Brunswick. I know Jackie, from talking to her previously, has been involved in a lot of projects, a lot of passion projects in the sport and rec field. And is going to talk to us a little bit more today around some of our primary focuses on exclusionary mechanisms and barriers within the sport and rec delivery system. So very excited to hear from her and some of the tools and information we can learn going forward in our province. So just very few housekeeping notes. As you've seen, the session is being recorded. We'll have this up on the SARP website for the next few weeks so that it can be accessed later by others. And then from a question perspective, unless Jackie says differently, you certainly can use the chat function and those can be addressed throughout. If you do have to leave early, or I know others are doing some double duty between this meeting and others, you can certainly drop that in the chat. The questions can be answered and you can view them later as well. So there probably will be a chance to come off mute. And I know Jackie mentioned this will be an interactive session for those who are around. So my last little piece is if you haven't already, be sure to check out the SARP website for anything else that's happening this week, including a rec happy hour tomorrow for my interactive opportunity to network with some peers, as well to be part of our Rec Rumble challenge that's going on and vote for your peers in the province. So with all that being said, I will pass it over to Jackie and let her take it away.
Perfect. Thanks, Jordan. Just kind of because it's a small group, I like to take advantage of getting to know people in the room. So we will do a bit of just an introduction and kind of who you are and the role that you have. And we'll do that in just a minute. But I have a slide deck that I'm going to share with folks. And I'm going to speak to it. I'll probably go off script a bit. I've been doing this presentation quite a bit lately, so I'm just gonna see if this, Jordan, I'm gonna rely on you to tell me if things pop up or can't be seen.
Absolutely. So, that's good.
Great. So, yeah, actually born, raised in Southern Saskatchewan. I haven't been back since I left when I graduated high school, but my parents and we're still on the farm and my family's still out there, so I get back quite regularly. So it's great to be in a familiar space with people working and doing great things in Saskatchewan. So my work has largely for the last 12 years focused on access and inclusion, particularly for citizens that are experiencing low income. And that work tends to cover a lot of different populations. So in Canada, we have cohorts of individuals that experience marginalization and oppression, and many of them are rooted in poverty. So I work with a lot of diverse groups, but with a central focus on access and inclusion that comes from an economic limitation. So this work, albeit this presentation is some recent findings we've seen out in rural New Brunswick. We're seeing them across other places and in other parts of the literature as well. So there's a lot to this presentation and where the knowledge has come from. So for anyone that does want more information about the project that I'm going to refer to, there's a link here, and I'll make sure that Jordan has it. It's our project website where there's more details that can be found. So before I get into too much more, it's super important to me as a community-based researcher to introduce to you our team. So I work with what we refer to as equity-owed residents, so residents that are experiencing the lived experience of poverty, oppression, trauma, and marginalization, as well as I work with a collaborator and a human-centered design firm, and the partnerships are here. So we're a mixed group of individuals. There's our residents range with different identities. We have had Kyle was an Indigenous man. He has since passed away since working with us. We have an Indigenous elder. We have Hope, who is a newcomer from Nigeria. And we have Tanya and Corey, who are single parents with children with disabilities living in rural New Brunswick, along with our team members. So I think it's really important that you know and meet the people that are at the heart of the work that we're doing. So as I mentioned before, you're going to hear me use the word equity owed, or sometimes you'll read and see equity seeking. These are groups of people that have experienced significant collective barriers to participating in society, typically based on age, ethnicity, disability, economic status, gender, nationality, race, even religion, transgender status, sexual orientation. So I like the word equity owed because these residents are owed equity. Everyone deserves equity, but there are individuals that are owed equity and access. And so you'll hear me use that word, and that will encompass the diversity of groups that do live in poverty and low income in our communities. So just wanted to get clear on that. Before I continue on, though, I'd love to know a little bit more about those in the room. So I'm just going to exit out of my screen for a minute so I can see names. But would any, love that we have a cat in the house. I'm going to just maybe call on people to share, who you are and where you're working so I can just learn a little bit more about you in the room. That would be great. Does anyone want to kick it off? I do like to give a bit of choice. Laura and then Stephanie.
Sure. Hi, everyone. My name is Lara. This is Percy. He insists on being in every meeting. I work in my day job, I work for Volleyball Canada. I'm the athlete and coach pathways coordinator. So that is to say a lot of things sport management. And I'm also the chair of SARP. So thanks for presenting today, Jackie. Really looking forward to it.
Awesome. Thank you. Stephanie?
Hi. I feel I should take my hair down so that you can actually see I have hair. Anyways, my name is Stephanie Cuddington. I work for Prairie Central District. I'm based in Wynyard, and our district is moving towards the values of inclusion and equity. So we're really focused on that going forward. We just had a strategic board review and all that kind of stuff, and they revised our mission, vision, values. So we're really excited about that because we see that it's so beneficial. And in my volunteer life within the community, I'm with the Kids Sport Committee, chairing that. And I also work with the Wynyard District Food Bank as chair, and I have been since its inception. So we see a lot of changing faces there, and newcomers and people in the area. So yeah, I just think I can always broaden my viewpoint and embrace, new technology, new wording, everything like that. So, and yeah, happy to be with your session. You were just so bubbly in Humboldt, and I remember that so well. And I was like, I'm jumping on. So thank you, sir.
Judy, and then Holly, and then Murray.
Hi, everyone. So my name is Judy McLeod Campbell. I work for the City of Prince Albert. My position now is Arts and Culture Manager, and so it's a new division within our also newly named department, Parks, Recreation, and Culture for the City of PA. So within that, currently I'm at the EA Rawlinson Center for the Performing Arts. That's where my office is. But in this new structure and new role, that encompasses a couple different facilities. So our Performing Arts Center as well as our Community Arts Center. I also have the responsibility of our Municipal Cultural Action Plan and Public Art. So that just kind of gives a little bit of background. And yeah, very, very interested. I haven't had the pleasure of hearing you before, Jackie, but I'm very interested in this topic. I've done a little bit of work with Listen to This, and yeah, any way that our community can expand our reach. I think we're doing some good work with community organizations, but can always improve. So looking forward to this.
Thanks, Judy.
Thank you.
Holly?
Yeah, I'm Holly Epp. I'm the executive director for the Saskatchewan Camps Association. So we have about 45 member camps across the whole province. We're doing accreditation standards for them and education opportunities, advocacy. That's kind of my role, to come alongside and cheer them on. And so any tools, resources I can get to help them just kind of expand. People who know about summer camp, and those that don't, sometimes it's just hard to know how to reach them or make it a place that they really feel like they're going to have those benefits and values. So, yeah.
Yep. Murray, you're up next.
Yes, I'm Murray Heidelbach, and I heard you speak in Yorkton. And one of the areas that I'm looking at in the research right now is rural recreation within community development. And what I'm finding is that in the 21st century, is the mission drift is significant. It's moved to sport and tourism, and recreation is covered by charities and NGOs. And so what we're looking at is, do municipal government and provincial government and academic institutions actually look at getting back into leisure as a right as opposed to a privilege? And you're one of the few that's actually doing any research in this, which is unfortunate. Probably Troy Glover's the only other one I know.
Yeah. No, thanks, Murray. I been asked to sit on the UN panel for poverty reduction and leisure, and my number one argument is it's not a right, and that we will hit on that today. So I'll touch base on that. It's interesting, Murray. This is a great segue because what I'm seeing in rural communities in Manitoba, where I've been, and out here more recently, is that the model for recreation outside of those that are in the municipal sector, it's all charity based, including sport. Sport's a charity based model. It's all fundraising, and it's largely operated in rural communities based on parent ideologies because parents run. Jordan and I had this chat, and Laura, you know this, like coaches are parents and it's an extension of parenting. So, but sport has a bit more power and prestige in community, but recreation budgets tend to pay for the facilities for this. So it's a really dynamic situation, and it lands in this territory of access and inclusion. So I'm going to throw back on my slide deck and we'll get going into this. And yeah, I'm really excited to chat with folks. So let me get back to my sharing here. So you don't have, you can just pop this answer into the chat, but I want to, I'll make my screen bigger. I want to center this discussion to start with about belonging and how do you know you belong? It'll make sense why I'm doing this with all of you, but just take a minute or so to think about a space or a place or an experience where you knew you belonged. And I want you to think about it. Try to put yourself back in that space. It could be a curling club. It could be on the ball field. It could be at like your knitting group, at, you know, the volleyball court, or it could be like, maybe it's at a camp retreat with staff. You know, it could be in your school. And think about, what do you hear when you belong? What do you say or do when you know you belong? What do you feel? And what do you see? All right, I'm going to be mindful of our time, but does anyone want to share just where you belong and one of the hear, feel, see, say, or do? I'll kick it off. I'll kick it off and give you an example. My physio clinic. When I walk into my physio clinic, the first thing I hear is my name, and I hear it greeted with enthusiasm. It's almost like walking into Cheers when everyone's like, Norm. That creates a sense of belonging for me. Stephanie?
Not exactly that scenario. A couple weeks ago when I went to a country church, I was trying to get in the back door because it was right at the hour, and the old door was really wiggly and the doorknob. So I opened it and creak, 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 and then everybody in the church, and there was maybe about 9 people, but they all turned around and said, "Oh, I'm glad you're here." And I was
Yeah.
like, "Oh, wow." What a response. And I did feel like Norm. That's
Yeah.
exactly what went back to in my head. And then the next thing I know, I sit down in a pew, and a friend comes up and she says, "Would you like to read, please?" And I was like, "Oh, yoy, this is really welcoming."
Yeah, absolutely.
Yeah.
Judy, did I see your mic come off?
Yeah, you bet. I mean, I think our community majority is Indigenous.
Yes.
And so I attend a lot of, and I'm part of a lot of coalitions and meetings where you walk into the room and the seating is a circle. And I think that alone, right, when you see that set up, you already feel welcome because you're part of a circle. And if there's not enough chairs, the circle gets bigger. And I think it's become a common practice here, and it means a lot.
Oof, Judy, that sticks with me. I got goosebumps. I'm gonna remember that. Thank you for sharing. Anyone else want to share one more if you're comfortable? Keep this in the back of your mind as we move forward. Just keep your kind of what you note or, beside you, because we're going to come back to this notion of belonging. So I'm currently in New Brunswick, and I'm working on a multi-year project right now where a lot of this work is coming from, but a lot of my work over the last 10, 12 years is threaded into this presentation. But I'm working with a provincial branch in New Brunswick called ESIC. It's Economics Social Inclusion Crown Corporation. They're in charge of poverty reduction. And they had in their plan, they work with a 4 or 5 year cycle plan addressing significant issues in the province. And one of the action items was increasing access and inclusion to sport, rec, and leisure. So SRL is sport, rec, leisure for residents living in poverty in New Brunswick. And so they asked me to work with them in 2 regions. They wanted to test out some ideas or work in 2 regions that were largely rural. And one region in the north is Francophone, and we have an Indigenous community in that top northern region, number 2. And then we're in region 10, which is coastal and island communities, mostly Anglophone. And I'm situated in region 11. So these are just kind of like I guess in Saskatchewan, they might be like kind of like SARM, if that still exists, like the regional municipalities. So we've been doing the work in these 2 rural regions in communities in these regions. So I just want to emphasize the rural nature of this work. I think that matters for practitioners that tend to work with and in partnership with smaller communities. But this work, whether it's rural or urban, the issues and challenges don't change, particularly amongst what equity owed residents are experiencing. The urban and rural environments change in terms of different challenges with what's available in some regards. So we're just starting year 3. We have spent a lot of time doing background research, building relationships in these regions, and we've also been doing as we went through this process of designing with residents, we have built a lot of relationships with equity owed residents. I could spend the whole presentation here, and I don't want to. I just wanted to give a highlight of kind of our phases of preparation for being in community. Coming in as a researcher out of an institution is tricky. We're not always, we don't want to be perceived as parachuting in to fix a community. So we spend a lot of time building relationships with stakeholders in the community. So all of you, if you were in those 2 regions, we likely would have contacted you to just understand and start learning about your communities. We identified roughly 90 poverty reduction stakeholders. We contacted like tons of them to do interviews with, just to learn about what's happening in your community, what are the challenges you face to addressing poverty, what are you seeing, experiencing in your own professional practice and volunteer roles. From those interviews and those connections in those regions, we developed relationships with people we refer to as community connectors. And community connectors are people that work frontline with equity owed residents. So in New Brunswick, we have schools with school community coordinators. We would work with family resource centers, food banks, libraries, health network coordinators, different people that we knew had trusted relationships. And that took us about almost 4 or 5 months to kind of get to that point. We then ran workshops in each of those regions to better understand the experience of living in poverty, and trying to access sport, rec, and leisure. And we ran 11 workshops with roughly 100 equity owed residents in attendance. What was really cool about these workshops is we did design them so that we were working with the community connectors to recruit individuals. And we had workshops that kind of ended up centering on a particular identity, even though we all hold multiple identities. We had a workshop with seniors. We had a really amazing workshop with an Indigenous community in the northern region. We worked with families that have children and adults with disabilities. We had a group of single parents and grandparents as well, and we had several groups of newcomers, and then we had workshops with mixes of people, but essentially we had just over 100 involved. We've also done training and workshops in New Brunswick, and I've done several workshops and day-long events and training for municipalities and other groups outside of this project. People want to learn what we're up to. So the meat of this presentation is to share with you what came out of the design process, which was the end of our year one, which was from those workshops. We worked with and invited 5 equity owed residents that were really engaged in the workshops to work with us for 6 weeks online to go through what we call a sprint design workshop. And it's where we took all the data that we've collected and we presented it to this group of citizens and the connector. And we took them through basically a really creative brainstorming solution space, saying, well, first, they validated the data that we collected. They emphasized that the findings were correct. And then we took them through this really cool process of identifying what's the root of the issue, what are the solutions you'd like to see in your community. They came up with several different solutions to how do we create a more equitable, accessible, inclusive recreation space and experience for residents. And so that kind of gets to this question of what prevents equity owed residents from accessing sport and recreation. So when we sat down with all the data and the residents, they had shared, and this is from the data, that to feel like you belong and that you matter takes more than what is happening in community right now. So across my research and other jurisdictions, including this project, what we're seeing getting in the way of inclusion is actually some of the things that we're trying to do for inclusion. So you might see yourself in some of this, and this is not to cast shame or point fingers, but this is largely how I see the sport and rec sector in Canada operating when it comes to intersecting with the social determinants of health. So the gray line at the top is, I'm just going to close a window so I can see this better. There we go. Is for citizens that have limited access to the social determinants of health. So that's job instability, lack of income, poor working conditions, living in really rural, remote regions, unsafe housing, poor access to transportation, low levels of education, race, ethnicity, gender. Anyone that deals with limited access in our study, we found that their leisure experiences were largely small in experience. They were unstructured. They were in a do-it-yourself on their own or with peer or with family, but they were really unsupported. As you move across that column to the right, you'll see where there's a larger repertoire. And for families that could access subsidies for kids sport, Pro Kids is just another type of subsidy out here. I think Saskatchewan has Creative Kids as well. Those types of subsidies, you would see the leisure experiences expand a bit for families and individuals, but again, those are typically children focused, or reduced membership fees, those sorts of things. You would see a little bit more choice and opportunity. the middle, the blue line is if residents that had maybe a car, had some, some income, still low income, they were able to engage in parks and trails, but those are unstructured for all. So those would be access for all residents, regardless of their class or status. And then structured for all would be events or activities that were kind of offered by libraries or municipalities or rec centers, free low-cost events, low-cost programming, because they could get themselves there and experience those. And then the bottom is basically people that have access to money, cars, good livelihood, lots of access to the social determinants. The sport and rec sector caters to them. At the end of the day, most municipalities' largest budget items are feeding the middle upper class families in our communities. And I see this across the country. So structured, organized, leader-led, staff and volunteer supported, facility-based, travel required sport, recreation, arts are all largely only available to those that have the means to be there. So the interesting thing is the higher the investment from community sport and recreation, the larger your repertoire is, but it requires a larger budget. So those that have the money get access to the leaders. And they're more likely to have a deeper, stronger community connection versus those that don't have a weaker sense of community connection. So this is not new, I'm sure, for many of you that work in community, but this is kind of how we're seeing poverty interact with access and inclusion, is that the people that need more of our time and our money are getting the least amount of it. And they're getting bits and pieces of it through subsidies to try to fit them into a system that was never designed for them. So one of the challenges around sport and recreation in the country is that to create the delivery system that we currently have with the limited funding that we have requires the system to generate income. When you generate income, you target a market that can afford it. When you target a market that can afford it, you exclude others that can't afford it out of the design. So we design for middle, white, upper class, cisgendered, able-bodied people in this country, Saskatchewan, New Brunswick. And as a result, we have a system that's built for them. So what ends up happening is that we create subsidies like Kids Sport, Creative Kids, and these are meaningful. I'm not trying to shame our subsidies. If we don't have Band-Aids, we bleed out. And sport and recreation are really important. But there are subsidies that are like a puzzle piece to the system. And some of these subsidies don't actually fit the lived experience of people living in poverty or low income. You can provide all the kids sport money you want to some of our families. They will not enter an arena because they don't feel that they belong and that they're treated well, or they can't get a vehicle, or they can't fit the mold. So sometimes our subsidies only work for those that have marginal access to the social determinants because they have the means to be able to fit the script of what sport and recreation look like in our country. So the reason I'm sharing this is because, get back on my screen, is the unintended consequences for some of our families that get access to free, low-cost events, one-off programming, and subsidies is it actually unintentionally creates the effect of what we call othering. Othering is us versus them. Othering is a disempowering process, and it's a discriminatory label. To be othered is to be recognized as being different from the norm, from those who are in power and who are socially acceptable. So you could think about those that are socially acceptable are people that are in your arenas and in your fitness centers and in your parks and on sport teams, on the volleyball team or on school clubs. There's these norms of fitting in and belonging that happen there. Some of these quotes actually came from one of our Indigenous elder, Colleen. She was talking about not being able to see elders, not seeing elders in the recreation and aquatic center that's not in the reserve, it's just off the reserve. And she referred to the regulars as those that were not Indigenous. And she said there's the regulars who look at you as if, how did you get here, referring to the aquatic center. Because the price and because of the regulars to think that they own the particular space, like not putting it out there for more people. So one of the things that came up during our discussions when we started looking at access provisions that were offered and why they don't feel that they belong or that they don't use them, it became really clear to us that when we design these provisions that we try to include, it sometimes ends up creating this notion of that they're being othered. And I'll give you examples. So what causes this? It goes back to Murray's point, the prioritization of revenue generation. If we don't have a right to leisure in this country and we don't have a budget and a government that values it, we don't have a choice but to generate revenue. But what this does, it leads to sport and recreation systems, norms, and belonging being dictated by those that can afford to pay. White, able-bodied, cisgender, middle, upper-class residents, we consider this dominant tier. So what those families, individuals that are white, that are able-bodied, that are cisgender, that have money, deep pockets, what they value, what they believe, what resources they have, we design sport and rec around them because we don't have all the money in the world to do it for all. And so transportation, money, social networks, and knowledge of this group is how we built our sports system, is how we built recreation. It creates a two-tiered system. Those who can afford to be there all the time, whenever they want, the dominant tier, the regulars, as Colleen would call them, and those who can't only get partial access. So an example of this, and maybe some of you see this, again, this is not to create shame, but just a level of awareness is that some communities will offer free swimming at certain hours of the day or certain hours of the week. And that is partial access that says to some of our families that they don't belong. We only get to be there for an hour. That space isn't for me. It almost feels like this segregation of the haves and the have-nots in some of our provisions. Again, I know that the core of the recreation sector, I'm most certain would want to open up access as much as possible, but their hands are tied. And so we do the best that we can. Rec and sport then becomes seen as a luxury that you have to earn. And so what ends up happening is that our families talked about the subsidies. I think it might be I wonder if it's my next slide. I'll come back to it. But essentially what ends up happening is that this is a quote from one of our residents that's on our design team. She said, why is it that people who live in poverty often feel undervalued? Because we are. Profit and profitability comes first. And sometimes the barriers aren't even thought of by the sports, leisure, and rec activity coordinators and the people who come up with these things. They're not thinking of the poor people and all the barriers we have to jump through to get to sport, rec, and leisure. When participation in sport and rec is dependent on socioeconomic status, it proliferates, like compounds, the cycle of privilege, and it guards access to participation because we create this othering effect. So what ends up happening is that our residents, even when they said that I talked about subsidies, even if we said you can go for free, I remember one of the residents said that how in a small community, people will know that they can't afford to be there. And that if they can't afford to be there, even if you were to give it to them for free, they wouldn't show up. It's because in Canada, we have created this luxury attached to sport and recreation. And if you're living in poverty, people have on losing internalized oppression, where they start to believe that they're not worthy of the things that they actually deserve, and they won't believe that they're worthy of these benefits that come from sport and recreation because we've attached that you have to earn access. Living in poverty for a lot of our families comes with this cloak of shame because in Canada we have these values around being economically contributing to society, and people that are living in low income situations don't feel that they're respected for just being who they are. They would be more respected by the norms of our society if they were earning their way. So this ideology, I guess, or this philosophy, the way that we operate, is an invisible barrier that is really hard for all of us to break through. So when it comes to our residents feeling and, how do they experience what we've called undignified access, they hear things like, we can't help you with that. You'll need to provide proof of your income to get that subsidy. They'll say to themselves, I don't think this is for me. I just want my kids to have fun. I'm uncomfortable. They're looking at me. They'll feel guilty for prioritizing their needs or indulging in recreation. They feel like all eyes are on them or that they're out of place. Getting here is not worth the hassle. They feel shame. They don't feel that they belong. They get the looks of impatient staff, judgment, they see high fees. They don't see that we can help people through financial assistance. Often some of those are hidden. They see regulars with better, and they see eye rolling. So I wanted to come back to the belonging piece, because what ended up happening for our residents is, when we started our project, it was about, the government said we want to increase access and inclusion for equity-owed residents. We're like, great. The residents, when we went through our sprint design, like that 6-week design, they said, we don't want access, we want to belong, and we want dignified access. So now we work from the place of designing for belonging and creating dignified access. And the reason we focus on dignified access is because we want to reduce the feeling of what othering can look like in recreation. So these are unintended consequences that come from sometimes the ways that we want to do access and inclusion. So when we limit access to facilities based on free or low cost hours, it sends a different message to residents that this place isn't for everybody. I've seen this in research when I first came to New Brunswick. A lot of municipalities are like, oh yeah, we do inclusion. We do a lot of free events. Don't stop doing free events. Please continue to do them. But I want to provide a critical lens, is that ongoing programming that requires registration fees, that's where people, and kids in particular, get access to leadership, skills, instruction, and guidance to enhance their leisure, physical literacy, their sport, their skill development, their parts of teams. That is ongoing. That's a privileged space. The one-off events don't offer the same depth of instruction and leadership and guidance. It's a tier 1, tier 2 kind of experience. And the message sends that I don't get better. The financially subsidized like I'm working with Kids Sport. I'm actually working on a presentation for them next week for the national office. When we subsidize only certain activities, so Kids Sport's centered on sport, which is great. And I'm speaking to the province that's got creative kids, which is awesome. There's provinces that don't, but I want to say in other regions, Kids Sport and Jumpstart, some of those subsidies don't work in really rural, remote regions because they actually don't have the activities that fit the criteria. When we don't value a broader repertoire of activities, it diminishes certain values of leisure that come from different diverse groups. So we have lots of newcomers that maybe don't want to participate in certain sports, or they can't participate in the ones that are offered in their community, but they value outdoor activity, but we don't subsidize those. It says that what they want doesn't matter. Proving you're broke. If I could change one thing, it would be that. It creates an enormous amount of shame and stigmatization that can really quite harm people through that process. Lack of diversity in programming staff. So if you work in sport and recreation, in education, really looking around the room, do we represent the people in our community? When we don't have diversity, it denies visibility. People are looking for people like them to feel that they're in community with others similar to them, and we deny their visibility when we diminish diversity in our staff and our programming. Complicated forms, rigid payment options, shame equity-owed residents because they haven't earned enough to be there to begin with. Some subsidy programs do surveillance. They'll say they'll audit families, and this just tells them that they can't be trusted. Time-sensitive, intensive programming. So this is more about sport. Just says to equity of families, they don't fit in. These activities aren't meant for them. They don't get to have this experience, and hidden access fees. So sometimes there's really amazing subsidies in sport clubs, but they don't communicate them outwardly. and they don't disclose them. You only know about them behind the closed door or back channels. And this just creates this narrative that equity owed residents aren't welcome. So this creates a lack of belonging. The opposite of othering is belonging. So when we're othered, we don't feel that we belong and that we fit. So our residents shared with us that when belonging is brought about due to the recreation, the way we design these provisions, it creates this othering and this lack of belonging. So our residents end up feeling unaware, ineligible, uninvited, and unwelcome. They feel a sense of guilt. I shouldn't play because I have mouths to feed and bills to pay. This goes back to the earning, right? Being on social assistance. And in smaller communities, many people know who is broke or low income or struggling, and their poverty can be visible in a different way. That community shame, whether it's explicit or implicit, creates this sense of guilt that people are like, how did you get here? Knowing that they're on social assistance or that they're struggling. Equity owed residents feel fear of public shame and judgment. I don't deserve to play because I haven't earned it. I know that your providers are only welcoming you here because you got that giant grant to do it. This came up quite a bit when grants are targeted to a particular group, it doesn't feel genuine. There is this thought of sports and leisure being an indulgence rather than a need. I feel guilty if I spend money on pottery class that I'm so interested in. I feel guilty because that money could be used and needed in so many other places. I'm just going to keep an eye on the time. So I think this is my last slide, and I'm going to open it up for more discussion. So what ended up happening with our project is we redirected our focus from how might we increase access to these activities to how do we create a sense of belonging that creates dignified access. And the reason why is because shame and trauma, discrimination, racism, stigmatization are social and emotional. Some of them are physical experiences connected to living in poverty. Yet most of the ways that we try to increase access to sport, rec, and leisure only address the objective, which is the lack of financial. So when our access provisions don't address shame, trauma, discrimination, racism, and stigmatization, but actually perpetuate them, we don't actually get to belonging. We've just shamed. It's almost like walking on hot coals trying to get a subsidy. For some of our families, it's like, okay, I got to get my my notice of assessment. And it's like walking on hot coals to get to the soccer field. How much pain do I have to feel before I can get my kid into that activity? So our attempt in sport and recreation in the country, largely attempt to include equity owed residents, end up reinforcing the shame and the trauma because our system, federally, provincially, don't invest in the right for leisure. And as a result, we have to find ways to make up that income. And when we do that, we target a particular privileged group, and then it becomes us versus them, which creates this othering effect. I'm just gonna end my slide there. Talk about a doomsday ending. But maybe what I will share is what we've been doing with this knowledge since. So we have since, that was kind of came out at the end of year one. So back to the sprint design, knowing all of this, our residents got to brainstorm solutions, and there's 6 or 8 solutions at the table, and they came down to 2, and we could only afford one with the funding. And the what we call prototyping. So we don't pilot. Pilots, like you've got a solution and you know it and you're comfortable and confident with it. Governments do a lot of piloting. It's common language. We're in the space of experimentation. So we like to prototype first, and we like to test out ideas before we launch the pilot, because it's so much easier to test and fail at something in a small experience. So we're prototyping a co-design. So we've been co-designing for the past year with residents and sport rec providers. So we've matched and worked with equity-owed residents working side by side with sport and rec practitioners to design the solutions that they want to see in their community based on their lived experience. So we've just run through 5 co-design experiences in the past year, all with the residents that you met at the beginning of the presentation. And we've just run the research on that, and that's been super cool. And now I'm a big fan of co-design and how do we do co-design? And we're going to expand on that in year 3. So not all is lost. We are trying to work at what we're called, the residents call themselves the system shifters. And so the system shifters work in the co-design with practitioners that are looking to, to create new ways of doing work in the community. I could go on for a day or a week on this stuff. I will park it and open up, if folks have questions or curiosities or would love to challenge any of this. I do know there's amazing work happening in community where some of these provisions work really well. So I should preface that I'm aware that the spectrum of the lived experience of poverty, some of these experiences that we offer are really beneficial and some aren't, and they're quite harmful. So I do know that I want to honor that too.
Maybe it's too soon, Jackie, but do you have an example of a system shifter that?
Yeah. Why don't I share the one with Colleen? Because you talked about Indigenous communities, Judy. So this is one of my favorite tactics. We call them tactics. They're short term. They're not meant to be long because when you want to test an idea, you just want a safe space. So I'm a proponent of testing. So Colleen she's a Spitfire elder. She loves this work. She's a tell it as it is type. And she's like, elders aren't in the aquatic center. And she also likes to tell all the elders what they should be doing. So it was entertaining. And she wanted the staff at the aquatic center to make the facility more welcoming for Indigenous elders. We're like, great. What do you want to do? So we invited the recreation director we invited them into the space of co-design. He was on board. So our team, Colleen and the rec director, picked the issue that Colleen wanted, and she's like, this needs to be more welcoming. What experience could we create? They created, this was really cool, an elder bus trip and tour. So the elders got on a bus. It was a 5-minute drive to the recplex. It was they're right side by side. They got on a bus, they drove to the rec center, and we helped the rec center and Colleen coordinate an information sharing experience where the elders got to learn about what was being offered in the facility, meeting the staff, and share with the staff what made them feel comfortable and not. Colleen was adamant that the Indigenous flag needed to be there. So we were on Upaganjik First Nation. Indigenous language needed to be there. And that would help in terms of just for the info session. But Colleen wants it there all the time. Anyway, really cool. We had 15 elders. We did small sharing circles where we had staff sit in a small sharing circle with several elders, and we had it facilitated where we asked questions and the elders shared. I learned about naked bodies and discrepancy being really important to the elder women and that they wanted curtains up. We would never have heard that. That would never have been shared. Mm-hmm. They don't feel comfortable being in that space. Even though other people would be okay with their naked bodies and body positivity, there's a generation and people that aren't. And so there's discomfort in the change rooms. So they're like, we need curtains. They wanted to test out, they didn't know what spin classes were, the language we use, right? They got to try chair yoga. So they sampled things. So the whole thing, we did this all in a couple hours. Such a success. More elders are in the facility. That was the goal, right? And so Colleen still hasn't seen their flag put up, and we're going to follow up. But there's that was an example of a mini co-design. And we did the research on it. We asked Colleen and the director, we did some interviews with them separately, and Pascal, who's French. So that's the other thing, is we were in a Francophone recreation facility with indigenous elders. So we were diverse in different ways. And we're in a rural, remote area where poverty is quite high. And Pascal said the best thing about co-design is that it bridged people together that they couldn't reach, that it started building relationships. The research shows, just from, we've done 5 mini experiment, like mini tactics. We did a social skate night with a school that many families can't skate, kids can't skate. We did a trail audit. Lots of residents don't get to give feedback on outdoor recreation infrastructure because they don't feel comfortable coming to town meetings. We did one with newcomers on a pop-up play box. They wanted access to unstructured recreation activity because they can't afford sport, but there's nothing else for them to do in that community. So we did a co-created play box. And then we just finished planning, and we're going to launch it, but a wellness fair in a Francophone community to bring people that are the providers into a wellness fair. And it's an intergenerational activity to increase awareness of activities. That's yet to be implemented. At the end of the day, the research showed, and I'd love to go on about this, the practitioners that were in the co-design from start to finish, Judy, the residents felt welcomed, they felt belonging, they had power to make decisions. It was relational. And then we had some of those tactics, the practitioner didn't help out, or they were there for logistics but had to do other things, like they weren't there building the relationship. It felt transactional, and it actually created, the resident felt like a burden. They felt that they didn't belong. And so yeah, we're just coming out with this research, but those are the examples I have.
Yeah, that's awesome. Thank you so much.
Yeah, thanks for asking. Murray, go for it.
Well, yeah, I really like your discussion on other, and one of the things we were looking at, that poverty is really discrimination. And so the area that I find is complicated, though, is using sport and recreation and leisure and play as if they were all synonymous and homogeneous. I don't have a problem with that at the participant level. I have a problem with it at the policy and the professional level. CPRA does the same thing. Sport by definition is a privilege. It's not a right.
No.
If I'm not good enough, I get cut. Even if I can afford it, I get cut. And so, and it also has become almost, and you mentioned kids sport, I got the same issue. It's criteria top down. And so the charity part, I have a problem with when we accept recreation as being accessible to everybody, which almost everybody says, and then our whole system says sport and recreation, or recreation and tourism, and they never say recreation and play, but they'll say recreation and leisure. Well, by definition, recreation is a leisure activity. And so I think the practitioners are, I like your idea of co-design, but most are tourists, just watching it and running facilities and running programs. If we're going to have recreation, we wouldn't be running programs, we would be co-designing them. And so I like your approach, and I'll adjust some of my research on that, but there's no way that I'll go with sport and recreation as being a valid discussion.
No, it's problematic because they don't want to change the way sport is experienced to fit everybody in. And so that in and of it's, but yet most our resources go to sport for it to like, most of the subsidies that are available push populations to sport. So an example of this, I always give this one in a presentation. When I worked in Manitoba, they don't have creative kids. And there's an organization I work with that works directly with low-income families, and 2 boys wanted cameras for photography, but nobody subsidizes cameras, particularly gear for a family to take home, unless like they just don't do that. So this organization was like, yeah, that's their mandate. We will support your kids' photography interest or scrapbooking or whatever. And the reason we have subsidies that often target physical activity is because it's a covert way of governments to get populations to move, to weigh less, to get healthier, to cost less, be less of a tax burden. And they use like these are all, if we're getting really critical, that's what the fitness tax credit was supposed to achieve when the conservative government had that available. But they're poorly designed because these two boys, no one would fund it. It's not a physical activity. Well, what did they do? They went doing wildlife photography. They're out hiking and they took their mom. So now you got 3 people active in the wilderness doing physical activity on a time that suits their needs in a space that feels safe, that brings them joy. But we don't fund that. We fund getting you into a rink where you will feel like shit because no one else will accept you. I'm being really broad, but my families, when they have to fundraise money that they didn't know they had to fundraise, it's the most shaming experience when they're also trying to collect pop bottles to feed their families. So like, there's such the problem for me is the awareness of these issues from the policy and decision makers. Not all of you, I'm sure you are all close with community in some way. The further up you get, there's just no idea of what the lived experience is like. So yeah, we fund these things we think will bring inclusion, but sport is built on the idea of competition and getting cut. Thanks, Jordan, for putting the link in there. There's reports from our Reimagining Access. So the othering piece today, there's a report. There's one on the social determinants. There's one on our year 1 report. Our year 2 report will be coming out soon, but that's where you can get updates on our information. And if you need more access to data, let me know. We're easily findable through that website.
I would just have a follow-up question then. Do you use a definition of recreation that you're using in sport and leisure?
They're all they're all different in our document. They have to, yeah. We keep sport and recreation and leisure different by definition.
And is there a list of other researchers like yourself that are doing leisure and recreation in rural and remote communities? CRRF have done some, but
Kyle Rich out of Brock is the only other one I know of. And he does a little bit more with sport, and myself, and yeah, it's the funny thing is it's I remember 12 years ago, no one was talking about poverty and no one would fund the work I was doing. And now I have lots of funding and people are now talking about access and inclusion. And rural is tricky too. Like they feel forgotten in the work. So I know Kyle does quite a bit and myself.
Okay, thanks.
Yeah. Thanks, Judy. Yeah, thanks everybody.
Yeah, I think we're at 1 o'clock here. So if we are done questions, just say thank you, Jackie. Really appreciate it. Obviously, those that are in attendance, appreciate you guys all showing up today. And for those that are able to view the recording later, I'm sure we'll get great insight out of this. And we look forward to working more with you and hearing how some of your research and initiatives move forward. And yeah, just thank you everybody for participating in Recreation Professionals Week. And we hope you have a great rest of your day.
Well, thanks for putting it on, and